And this week, we'll be talking about a timely subject, vaccines. I say timely because in recent days, we've seen U.S. Secretary of Health and Human Services RFK Jr. and his government allies take aggressive steps to discredit immunization treatments that offer proven, often life-saving benefits. This included revisiting the debunked idea that vaccines are linked to autism, limiting COVID vaccine availability among Americans who aren't senior citizens, stacking advisory committees with fellow vaccine skeptics, and, in the case of one of those skeptics, raising dubious concerns about effective new immunization treatments that have already begun to protect young children from the effects of RSV. Meanwhile, in Florida, it was announced that state officials will end all vaccine mandates, including those governing school children, a move that experts warn could lead to severe disease outbreaks among not only Florida residents, but also many of the tourists who help drive the Sunshine State's economy. With me to discuss this issue is Dr. Jake Scott, a board-certified infectious diseases physician and clinical associate professor at Stanford University School of Medicine. He is also the author of two recently published articles at Quillette.com, titled A Baseless Attack on Groundbreaking RSV Therapies and RFK Jr.'s mRNA Betrayal, How Political Ideology Trumped Nobel Prize-Winning Science. As you'll hear, Dr. Scott can get somewhat emphatic when discussing this issue. As he explains, that's because he spent years trying to debunk vaccine misinformation. Understandably, he finds it exasperating to see this misinformation getting a new airing from the same public officials and advisors whose views are supposed to reflect proven medical science. Before proceeding, I should say that this is an important issue for me as well, and for my Quillette colleagues. As you've heard often in the podcast introduction that just played, Quillette exists as a haven for free thought and heterodox viewpoints. But not every viewpoint that happens to be heterodox is based on fact. When it comes to vaccine misinformation, the editors at Quillette have had many opportunities to observe how easily pseudoscience can traffic under the false banner of dissident truth-telling. As Dr. Scott admits at several points in our interview, many vaccine skeptics come by their skepticism honestly, thanks to the mistakes and evasions that have stained the record of the medical establishment in the past. But when it comes to the immunization technologies discussed in this podcast, there is no credibly evidenced indication that they aren't safe for the general public. Just the opposite. COVID and MMR vaccines have each saved many millions of lives. And new RSV immunization treatments, which came online last year, have already helped keep thousands of babies and toddlers out of pediatric intensive care wards. I hope you'll enjoy my interview with Dr. Jake Scott, board-certified infectious diseases physician and clinical associate professor at Stanford University School of Medicine. Dr. Jake Scott, thank you for joining the Quillette Podcast.
Thank you so much for having me.
Okay, so I'm going to ask you about a couple of different kind of vaccines and some general questions about the unprecedented politics of vaccines that now exist in the United States. But let me just start with these claims. I feel like they've been around since maybe the late 1990s that purport to link autism with vaccines. The claims were originally made that maybe the mercury in, I think it was the MMR vaccines, combined mumps, measles, I think rubella. There were some claims that that was giving rise to the spike in autism cases that people started seeing around that time. That was debunked, and I felt like that was that. But now it's been rekindled, is that right?
Yeah, it's complicated, but you're right. So, and let me just begin by being very direct about this. There's no link between vaccines and autism. It's very clear, and this is not just my opinion or my judgment. And it's weird. I tweeted that literally, or posted it on X. I literally just wrote, "Vaccines do not cause autism." And I really try to be so careful not to post anything or say anything during any interviews that aren't totally accurate, because I mean, I'm fighting against misinformation, so it's just imperative that I be accurate myself. And So I totally stand behind that. It was interesting to see how controversial that was, because it's unequivocal that vaccines do not cause autism. It's unequivocal. And so, yeah, there's no link between MMR vaccines and autism. MMR is measles, mumps, rubella. And the 1998 Wakefield paper that started this whole thing wasn't just wrong, it was totally fraudulent. So Andrew
But it was like,
Wakefield,
if I remember correctly, he was like,
gastroenterologist,
and I think it was like an N equals
it was
20 study. Like it
12
was a
kids.
12, okay, 12 kids. Yeah.
Sorry,
Less than 20.
I get heated.
Yeah, yeah,
So Andrew
yeah, yeah.
Wakefield, he lost his medical license for ethical violations and for data manipulation. Okay. But so the study involved only 12 children. It used completely unethical procedures, and the journal that published it, The Lancet, retracted it in 2010. And the reason why I think this is so important to note is because it still influences parents 25 years later. I mean, we're dealing with the worst measles outbreak in 30 years, 33 years, and and it stems from this. This paper in 1998 that was totally fraudulent. There was this theory that MMR vaccines had some deleterious effects on the gastrointestinal tract that were sort of
Okay.
pathognomonic for autism. But I just want to emphasize that this really shows you the power of misinformation.
And this was before the heyday of social media. I mean, this misinformation spread. I mean, I guess this was around the time social media started to take root, but like, I mean, the misinformation started in the Lancet, which is pretty incredible.
Yeah, yeah, yeah. There was a large systematic review in 2020 that looked at nearly 2 million children in cohort studies, something like 9,000 children in case control studies, no association with autism. For thimerosal specifically, there's studies of nearly a million children across multiple countries that found no relationship with autism.
Is thimerosal the mercury-containing agent?
Yeah, but there's an important caveat there. So there's ethyl mercury and there's methyl mercury. The difference is that one lingers longer, and that's the one in fish, and then one is excreted more quickly. So the one in thimerosal is excreted much more rapidly and doesn't tend to linger. And so and the other thing is that I think is really kind of, I hate to use this expression, but the smoking gun, is that autism rates kept rising after thimerosal was removed from vaccines. And not just in the US, but all over the world. So if vaccines caused autism, those rates should have dropped. I mean, and that should be sort of the mic drop right there, right?
I too have had my adventures on this subject on social media. My favorite response, because I think I quote tweeted your tweet about how vaccines don't cause autism, and I think I supplied my own comment. I said, like, it's crazy to me that anybody in government is perpetuating this kind of stuff. And one guy's response was, well, if it's not vaccines, what is it? And that was like his mic drop moment.
Yeah. The association between vaccines and autism has been one of the most thoroughly investigated medical questions of all time. And the other thing is the clinical features don't match either. So like going back to thimerosal and mercury. So mercury poisoning causes ataxia, which is where you have difficulty walking and with balance, and it causes problems with speech and visual field defects. And autism doesn't present that way. And even the brain pathology is the opposite. Mercury poisoning causes brain atrophy, while autism causes more enlarged brains with increased cell densities.
And one doctor had an interesting observation for me. I think she said one reason she thinks the conspiracy theory lingers is that signs of autism often will manifest themselves in a child around the same time she was administering the MMR vaccine. So the vaccine timetable just happened to coincide with the developmental schedule of children, where parents will start to notice, hey, there's something unusual about my kid, and they'll get that diagnosis, which coincidentally, it happens to coincide with vaccination schedules.
So and yeah, and that's a very common point that people make. And I tell people, look, just to put things into context, autism is roughly 80% heritable and it develops in utero during pregnancy. The timing with vaccines reflects when symptoms become noticeable and when kids have scheduled visits. So it's a coincidence. It's not causation.
People often will externalize medical issues. It's human nature. You look for a cause for things.
For sure. I mean, I think that there's several things going on here. First, there's this consistent historical pattern where vaccine opposition emerges after a vaccine succeeds. And we saw it with smallpox in the 1850s, pertussis in the 1970s, COVID now. And so, success creates its own problem.
Success causes its own risks. The way I interpret that is, say, with smallpox, if you don't know anybody who has smallpox, you don't know the agony of getting smallpox, you don't know how horrible disease it is. So it's not something that enters into your brain. Is that what you mean by success causes its own
Yeah,
risks?
100%. Yeah. So vaccines are really victims of their own success, right? So when diseases disappear or when they're rendered less threatening, vaccine risks start to seem disproportionate. And it's hard to recognize how effective they were when the disease isn't around anymore, like with smallpox.
I mean, I have friends who are COVID vaccine skeptical, and when they send me information, a lot of it starts off with my cousin or my friend's cousin, was this 28-year-old ultra marathon run. They're always ultra marathon
You're right.
runners who got a vaccine or who got a treatment or some COVID therapy, and within like 3 weeks he was dead. So let's turn a little bit to the COVID stuff now. The autism MMR vaccine link was just total nonsense, but I think it is true that in extremely, extremely, extremely rare cases, there have been adverse medical conditions or events associated with COVID vaccination. Is that right?
For sure. One thing that I see a lot of is, well, you guys oversold COVID vaccines and said they were 100% safe. I've never told any patient or anyone in the public that anything is 100% safe. I mean, ibuprofen isn't 100% safe. Yeah. Are the COVID vaccines 100% safe? No. Are they generally very safe? Yes. And the other thing is, when people ask about the state of science and safety with COVID vaccines, I start with this scale, right? So we've administered over 13 billion doses globally with extensive real-time monitoring. So there's this fear that we're hiding a lot of data. We're not.
This is doses of COVID vaccine. That would be mRNA vaccines and also the AstraZeneca vaccine, which is not mRNA based. So all doses
Right.
of all
Right.
vaccines.
Not just Pfizer and Moderna, but all COVID vaccines. So we've administered over 13 billion doses globally. That's massive, right?
That's twice the world's
Yeah,
population, roughly.
it's unbelievable. And it's remarkable how well I think the safety monitoring has worked. Has it been perfect or flawless? No. Was the messaging perfect? Absolutely not. I mean, I took a lot of issue during 2020, 2021 with, the messaging not being sort of as nuanced and transparent and contextualized as it could have been. But it was also a rapidly evolving crisis,
With COVID, because of the nature of the disease, it was very deadly for people who are in their 80s and 70s, very dangerous for people in their 60s, maybe people in their 50s, a little less so, but still dangerous. Once you got down to the 20s and 30s, COVID itself rarely led to fatalities. In my mind, the main argument for, if you were an 18-year-old, main argument for getting vaccinated was so that you don't give it to your grandfather or your father or somebody else who's older. But is there any truth to the idea that, putting aside the danger of contagion, putting aside the danger of transmitting the disease to somebody else, which is a significant danger, so I'm removing a big part of the equation, but putting that aside, is there any truth to the argument that if you're an otherwise healthy 20-year-old getting a COVID vaccine, the risks are comparable to the benefits?
It's a very good question. But let me say, so in 2020 and 2021, I was just seeing patients. I was doing some research on the side. I was involved in some COVID clinical trials, et cetera. But I was so busy seeing patients and so busy in particular seeing COVID patients. I saw hundreds and hundreds and hundreds of COVID patients, literally. And I lost well over 100. And
No.
they weren't all in their 70s and 80s. Okay. I mean, I distinctly recall, and my colleagues have also said this, and some of my colleagues are not necessarily like, big COVID vaccine cheerleaders either. I think there's a misconception that COVID in 2020, 2021 didn't really cause harm amongst younger adults. It did. I mean, I distinctly remember losing a patient who was in his 30s. He and his mom were both hospitalized. His mom survived, and he didn't. And most people will be like, "Oh, he was probably obese and had diabetes." Well, no, not really. I mean, if you saw him at Trader Joe's, you wouldn't be like, "Oh, that guy's unhealthy." Not at all. And that's just one of many examples. And so back then in 2020, 2021, before the primary vaccine series was available, people were dying in their 20s, 30s, 40s. Okay. Were there 18-year-olds who were, athletes, or were there ultra marathon runners? Yeah, maybe not. But that's not to say that that risk didn't exist. And it's always a matter of weighing the risk versus the benefits, right? So with the first two doses, with the primary series, we're talking before the boosters, what really were the risks? Well, the risks were really, really low, especially for, adults 30 and up. Boosters, that's a different subject. Do healthy men in their, because myocarditis, is most strongly associated with men. Do they necessarily need, a booster every year? No. Okay. I'll be honest. And I've been saying that from day one.
And the condition you just described is a heart condition, yes?
Yes. So myocarditis refers to inflammation of the heart. So the highest risk is in young males after the second dose, but most cases are mild and with full recovery. And the other thing is the risk was higher earlier in the pandemic, and that might have been related to, the immune system and it being more sort of naive back then, right? And it's complicated, but these days the data are clear that the risk of myocarditis has significantly decreased. So I'm involved in a systematic review looking at the last 2 years of data, and our review found that the rate is fairly consistently around 2 per 100,000 doses. So that's 0.002%.
That's cases or fatalities?
Cases. There have been very few fatalities that have been directly attributable to COVID vaccines. In the US, there have been none.
Wait, say that again. The only way I've ever heard of myocarditis, if I'm pronouncing it correctly, I hadn't heard of that condition except in the context of people talking about it as a risk associated with COVID vaccines. But for all the talk of that, you're saying there have been no fatalities associated with myocarditis due to COVID vaccine administration?
Let me also clarify that myocarditis has been around forever. I had seen several cases of myocarditis caused by infections before COVID vaccines were made available. It's something that, as an infectious disease doctor, I'd probably see, a few times a year, and oftentimes triggered by a number of different viruses. So influenza, COVID itself. So in the U.S., the last I heard, there had not been any deaths attributed to the COVID vaccine. Okay. There have been in other countries. So in New Zealand, Korea, um, not a lot, but there have been. So I'm not saying it's not possible. Okay. The Korean study had the highest rates.
Talk a little bit about mRNA technology, because if I remember correctly, you had the AstraZeneca vaccine, which was not based on mRNA technology. mRNA sounds scary. As a layperson, it's been explained to me as sort of like your body's email system, where information is transmitted around your body using, I think the M actually literally stands for messenger. It's not hard for me as a layperson to think, well, if you're screwing around with the communication systems of your body, you can put anything, you can encode anything in that information. You can tell your body to do all sorts of horrible things. You can see why mRNA technology can be a very scary thing to people, right?
So mRNA technology is not actually new in terms of, use for vaccines. It's been studied for decades. What was new was using it for a pandemic vaccine. So think of mRNA, which stands for messenger ribonucleic acid, mRNA, as basically a recipe or an instruction manual. So your cells are like little factories, and mRNA is the instruction sheet that tells them what to make. So with COVID vaccines, with the COVID mRNA vaccines, we give your cells the instructions to make just one piece of the coronavirus, the spike protein. So it's like showing your immune system a mugshot of the virus so that it can recognize and fight the real thing later when your body inevitably encounters it, unless you're
And the
living.
spike protein is what attaches to the surface of
Right.
the host.
Yes. Yes. So your cells make this spike protein for a short time. Your immune system sees it and says, this doesn't belong here, and then builds defenses against it. The beautiful thing about mRNA as a technology is it's naturally temporary because RNA is inherently unstable. It gets broken down by your cells within days. It doesn't hang around, and it does not change your DNA. And I've had to say that a million times, but it's impossible. It does not integrate into anything permanent. Because DNA is in your nucleus, and the mRNA cannot penetrate the walls of the nucleus. It does not change your DNA. And for that reason, it's not genetic therapy. mRNA vaccines are not, gene therapies. It's just a temporary instruction that gets your immune system trained, and then it disappears.
I guess as a conspiracy theorist, you think, well, once you're giving instructions, even if they're temporary instructions, I can see how people's imaginations would run away with them. Let me put it this way. For at least a generation, we've all been trained in the dangers that malware can do to our computers. Whole Hollywood movies are based on computer viruses that go around. The COVID virus itself viruses themselves are barely constitute life forms. It's essentially just information. So information can do a lot of damage.
It's not like it's something we haven't seen before. There are, tons of different mRNA molecules floating around in our cells at any given time.
I think I learned this from your article that within, I don't know, a couple of hours or a couple of days of identifying the COVID virus, the virus that causes COVID, they already had programmed in the mRNA structure. After that, it was just a question of like clinical trials and developing a delivery mechanism. But because it's information, unlike sort of maybe traditional vaccines where you have to like use eggs and all this stuff to incubate things, like they designed it in very short order, right?
Oh yeah, yeah. That's the thing. I think it's really cool. So the reason why mRNA vaccines could be updated so quickly for new variants and developed so quickly for this novel, coronavirus, is because instead of growing viruses in eggs like we do for flu vaccines, we just had to tweak the genetic sequence and manufacture new instructions. So it's just like updating software instead of rebuilding hardware. And so the lipid nanoparticles that deliver the mRNA are essentially just fat bubbles that protect the fragile RNA because it's inherently unstable and helps it get into cells. And once they've done their job, they're broken down too. So it really is benign.
What about this argument? And I hear this all the time. I have a group of friends I visit every year. We always kind of we have so many common interests that we don't let this kind of stuff get in the way, but they have a lot of views I regard as weird when it comes to vaccines. And one argument that comes up a lot is, well, it's not really a vaccine because it's not 100% effective. Have you heard that argument that the word vaccine is a misnomer for any therapy that doesn't give you 100% protection? Like, because smallpox vaccine does give 100% protection to smallpox. But, the flu is 30%. COVID, it's more, I don't know, 50, 70, 80%. Like, have you heard that argument and how do you respond to it?
Have I heard it? I've spent countless hours trying to counter this from the very beginning of the advent of the COVID vaccine.
But I never heard that argument with the flu shot, even though the flu shot,
Right.
some years is like 20% or something.
Right.
It's even lower.
Right. So here's the thing. When it comes to the effectiveness of the COVID vaccine, the messaging has been very problematic. And so my focus on social media in 2020, 2021 was actually on this. It wasn't on, pushing back against, vaccine skeptics. It was trying to clarify this. So if you think about it, when you get a shot in your arm, the idea that shot could then lead to blocking any respiratory virus from entering your body is just, it's ridiculous.
Because it's a respiratory
Yes.
vaccine.
Yes. Same with the flu vaccine. Same with RSV. And so the goal should have been very clearly stated from the outset that the goal is to prevent serious illness that causes hospitalization and death. And by that metric, they've been phenomenally successful. So the idea that COVID vaccines, and I think that this really is it's given, it's been a lot of fodder basically for these sort of, folks who are so opposed to COVID vaccines. COVID vaccines should not be expected to prevent infection or prevent transmission. Do they help reduce the risk of infection and transmission? Well, I don't know. At this point, I don't know. Early on, before, there were any mutations, sure. Yeah, there was clearly evidence that it helped reduce the risk of infection and the risk of transmission. And that's partly why, that message was being put out there. But as it mutated, as most of us expected at the time, I don't know about most of us, but Paul Offit was saying this from day one. I've been saying this from day one. The vaccines should not have been expected to prevent infection because, otherwise it's a total recipe for disappointment. And then the term breakthrough infection, that just drove me absolutely crazy.
Breakthrough infection, that term was used to describe infections of people who had been vaccinated.
Yes. Yes.
But it signals like a dam bursting or something like that.
It signals that there was a
cataclysm.
Right. And so, and honestly, that has caused so much damage. So, there was that sort of notorious outbreak in New England where, everyone who got COVID had been vaccinated. Everyone's like, oh God, the vaccines don't work at all. And you said they were 100% effective, or 95% effective. Well, so yeah, they're not great at preventing infection. But it doesn't really matter. It shouldn't matter. Sure. Being sick sucks, right? I hate having a cold.
If your body's primed to fight it and it reacts more quickly and the viral load is lower, you're going to have better outcomes.
Yeah, but it works incredibly well at preventing hospitalization and death. Incredibly well. And it works better than the flu vaccine on that metric. But you just can't really expect a respiratory virus vaccine to prevent a respiratory virus from entering your nose, and your airway. It doesn't put up a magic force field.
My next question isn't actually related to vaccines, but it's a COVID-related question that I was hoping to get your opinion on, and I think a lot of my listeners would be interested. Long COVID. We haven't heard a lot about it lately. The idea of long COVID was extremely credible to me at first because you talk about these people having scar tissue in their lungs, even people who survived COVID, their whole respiratory system was traumatized by the experience. And I had COVID after I'd been vaccinated, and I couldn't bike up a hill for 6 weeks, despite the fact, it's not as if I was hospitalized. I was like, wow. I remember that's when it occurred to me, this is a really serious thing, that I was vaccinated and I didn't have what I thought was an especially serious case, but the effects really lingered, unlike a regular flu or cold or whatnot. So in those first 6 months or a year, the idea of long COVID made sense. It started making less sense to me maybe later on when people were vaccinated and the cases were milder. And I think there was one study I saw that something like 20% of people who said they had long COVID actually, tests showed they'd never actually even had COVID in the first place. What is your take on long COVID? Is it a real thing?
I've actually been involved in an NIH-sponsored long COVID study, the RECOVER trial and RECOVER study. Long COVID is real, but I think we need to be more precise about what we mean by it and how we study it. The condition exists. People, have had persistent symptoms after SARS-CoV-2 infection, what we call COVID, that can't be explained by other causes. So we see fatigue, brain fog, exercise intolerance, and other symptoms that can genuinely be debilitating for some patients. Okay. But here's where it gets complicated. So first, the definition has been inconsistent across studies. So some use symptoms lasting 4 weeks, others 12 weeks, others 6 months. Second, we don't have great biomarkers or objective tests for most long COVID symptoms. So we're often reliant on subjective reports, which are obviously problematic. Third, many long COVID studies lack proper control groups. So they don't compare to people who had other respiratory illnesses or account for, the massive psychological and social disruption of the pandemic itself. Right. So it's very, very complicated. What we do know is that vaccination reduces the risk of long COVID. And multiple studies show that breakthrough infections, even though I don't like that term, in vaccinated people are associated with fewer symptoms, shorter duration, and a lower likelihood of persistent symptoms compared to infections in unvaccinated people. And, the mechanistic understanding is still evolving. And like I said, I'm involved in this study. It could be viral. Not sure. It could be autoimmune processes. There are a lot of hypotheses out there, microclotting, autonomic dysfunction. There are probably multiple mechanisms in different patients.
It's real.
But it is real. And, and people are clearly suffering from it. I've seen a number of patients. I'm sure we all know some people that, were high functioning like athletes and then, developed, chronic fatigue and exercise intolerance and all this. So yeah, I think it's very important not to dismiss it, but I think the important sort of message is that we take patients seriously, we take their symptoms seriously, and we work them up appropriately. I mean, we do the necessary investigations, but we also need rigorous research with proper controls to understand what we're actually dealing with. So, the good, and the last thing I'll say is that the good news is that most people do recover. And I think we're getting better and better data. So some of the early long COVID research wasn't as methodologically sound as it should have been, but it's, and so it's harder to separate signal from noise in those cases, but it is, I think, getting better. And I think that we'll have a better sense. The other thing I'll say is that there are a number of other infectious diseases that have been associated with chronic fatigue syndrome, or ME/CFS, throughout history. I mean, a number of, tick-borne diseases and Epstein-Barr virus, So I think that this is a really good opportunity to learn more about, these types of syndromes, and lots more to learn, but yeah, it's real.
Before I let you go, I want to talk about RSV, which is also a respiratory infection. Thankfully, not nearly as fatal as COVID, but has the scary quality of afflicting very young people. So, like babies, toddlers can get very bad cases of RSV. Your first article for Quillette was about RSV, and I learned a lot from working on that article. One thing that was interesting about it is, so you talked about how I don't know why it actually hasn't gotten more headlines, but we actually have some groundbreaking treatments for RSV. One is you have what, as I understand, is an actual vaccine for the mother, but you also have treatments for the children when they're extremely young to help prevent them from getting RSV or to mitigate the symptoms, I guess, if they get it. But terminology is important here. In your article, you made the distinction between there's vaccines and then there's these antibody treatments. As I understand it, the children, when you're trying to protect them from RSV, you're giving them antibody treatments. If I'm getting the terminology right, can you explain the difference?
You're right. So the pediatric preventative therapies are not technically vaccines.
I've seen some media news articles actually refer to them as vaccines. So, like to a layperson, it kind of seems that way.
You can call them immunizations, right? So like
Okay.
I'm working on this review article right now, and it covers COVID, flu, and RSV. And so instead of saying vaccines, we're saying immunization. So
So that's the generic term for these preventative treatments.
yeah, these are long-acting monoclonal antibodies. They're not traditional vaccines, but functionally, they provide months of protection with a single dose. And we use this approach in kids because direct vaccination of very young infants for RSV has been challenging. Their immune systems don't respond as robustly. And, I think this is a very important sort of chance to recognize that, the history of vaccine research has not always been rosy or positive. So in the 1960s, there was an RSV vaccine that was a disaster. And it taught us that we can't just throw any vaccine at infants because the vaccine didn't just fail; it actually enhanced disease, and so it was tragic, and it led to today's rigorous safety protocols. Um, but RSV is it's the leading cause of infant hospitalization for respiratory illness worldwide. And yes, fortunately, it does not cause a lot of fatality. So for that reason, I've heard people say, well, since it doesn't kill you, then like, let's not vaccinate kids. Well, I've got two kids, and when my son was born, he had to go to the NICU because he was having significant respiratory issues. And it was awful. I mean, it was like the most traumatic experience of my life. I mean, to have your newborn, struggle to breathe and potentially die, or be at risk for dying, and to be gravely ill or critically ill, it's terrifying.
My firstborn had a subglottal hemangioma, which, as you probably know, obstructs the airway. It's like a benign, almost like a benign tumor that obstructs the airway. And yeah, she was in the ICU, and she's in college now. But I wouldn't wish that on anybody. That experience.
Yeah, no, it's awful. And I think my son has asthma probably as a result, and some respiratory issues as a result. And so in the US, yeah, RSV causes about 150,000 infant hospitalizations a year. But this past season, and it's crazy that this isn't more widely publicized. So that in the last season, in 2024, 2025, it was really the first time that we had effective prevention tools for RSV. And the results, I think, have been incredible. Real world data shows that there was a 30 to 40% reduction in hospitalizations overall for RSV, and about a 50% reduction in newborns under 2 months old. And we're also looking at this in our systematic review, and we've multiple studies now, I think up to a dozen or so, have shown about 63 to 89% effectiveness.
It's also, this is the most expensive part of your hospital, the pediatric ICU. Like, it's,
Yeah,
you just putting aside the humanitarian aspects
yeah,
of it, the resources freed up are enormous for other people suffering other conditions.
yeah, yeah. So there's nirsevimab and clesrovimab, which are the long-acting monoclonals for kids.
And you wrote about it in the context of, you had somebody, and now we're getting to the political angle here, somebody in a position of authority casting doubt on these treatments.
Oh, yeah, more than that. Yeah, so it was Dr. Robert Malone, who refers to himself as the original inventor of the mRNA and
Yeah, there's a
DNA
New York
vaccine.
Times article about that. And anyone who's interested in that, that's a whole other thing. The New York Times has an interesting piece on those strange claims. Tell us about the body that he's been appointed to, because it sounds like it's a highly influential body. Although one of the quirks of the story is he voted for the RSV to approve it, but then later kind of recanted. But can you tell us about this body that he's been appointed to?
Yeah, so it's the CDC's advisory committee, the ACIP.
And
So
what does ACIP stand for?
So Advisory
What is that?
Committee on Immunization Practices. What they do is they review all of the evidence, and they give, their recommendations based on their reviews to the CDC. And it's not binding. These are recommendations, but then the CDC director takes that and then, and then the FDA
And
makes
this is parallel to the FDA, because
yeah,
the FDA obviously has a role in this.
right. Yeah. They all work and together. But so he is a member of this CDC Vaccine Advisory Committee.
And whose
So,
decision was that to name him to that board? Whose decision was that?
well, so, Robert F. Kennedy Jr. fired the 17 ACIP members that had been longtime sort of public servants, a few of them who I've gotten to know that I work with at Stanford, who are just,
So he fired
yep,
all 17 of them?
yep, all
Wow.
17. For no justifiable reason. I mean, he claimed that there were conflicts of interest, which was total BS. And then he handpicked his own members, including Dr. Robert Malone, who has made some outrageous claims about vaccine, safety and stuff. And so when it comes to RSV, yeah, he along with Dr. Yafa Shiraz claimed that the CDC manipulated data about the safety of this RSV monoclonal antibody that was approved for kids, so nirsevimab in particular. And I think that this case really perfectly sort of illustrates how misinformation can emerge from within advisory systems. Um, and so they made, and I talked about this in that piece that you helped me with. They made three fundamental errors, basically. They inappropriately pooled age groups that should have been analyzed separately due to totally different,
Right, and this
co-vaccination
is the
pathways.
critics. These are errors that the critics made,
Yeah,
or Will Malone and this other doctor who's also a journalist
Robin
who
Malone.
kind of,
Yeah, yeah,
yeah.
yeah. So they made a number of fundamental errors that, no scientist I know would do this, but they inappropriately pooled age groups to get this sort of statistical, signal that is meaningless. They ignored that every death in clinical trials was actually reviewed by the FDA, and none were attributed to the monoclonal antibodies.
Does Kennedy appeal to mainstream Republican sentiment? Like, even in red states, it seems like a vast majority of people get their kids vaccinated. As a Canadian, it's not clear to me how Kennedy is popular. Because, well, in the artificial universe of Twitter, he does seem popular. Part of this is just the strange political system you have now in the United States, where like a crazy person like this, it's not clinically crazy to my knowledge, but how does this happen in a G7 country? I just it kind of boggles the mind a little bit.
I can understand that. I think that he taps into some real and understandable concerns that people have. Okay. Clearly, right? And there's been declining trust in institutions generally, not just health agencies, but government, media, corporations. And I think that people feel like they've been misled about various things over the years. And that creates an opening for someone who positions himself as challenging the establishment. And I had some issues with how, our pandemic response was, for sure. Like, I mean, in California, the schools were closed for way too long, and I was very vocal about that. Playgrounds were closed, swings were removed, and I had two toddlers. There were things that were just absurd.
In Ottawa, they created a policy that not only could you not visit your parents in an old age home, which made sense, you weren't allowed to walk by and wave at them through the window because
Wow.
this is true. Yeah, this is in Ottawa, and
Wow.
even Canadians who are pretty tolerant about pretty much any restriction on their civil liberties thought that was bizarre.
Yeah, or like the skate park that was filled in with sand. I mean,
Well, they put sand in the skate park.
yeah, in LA.
Okay,
And not being able to go to the beach. And yeah, there were a lot of things that were like that I would have done differently. Okay. But on the other hand, it was a rapidly evolving crisis, like I said. And I think, a lot of people were trying their best, et cetera. However, I can understand why people feel like they've been misled, why there was government overreach, and that created this opening for someone like him, who clearly is very comfortable challenging the establishment. And the pharmaceutical industry, it does have real conflicts of interest that people are right to be concerned about. I expressed a lot of concern about this, with with Paxlovid, for instance. I felt like that was being pushed a little too hard, and I couldn't help but wonder if there were conflicts of interest from certain people who were pushing it really hard. And so
that was a drug to palliate the symptoms of
that
COVID.
was a COVID treatment drug that was proven to
Okay.
be very helpful in people who had no immunity to COVID, but there were no good, high quality studies that show that it did anything effective for people who had been vaccinated. Yet it continued to be pushed for years, et cetera. But there's this revolving door between agencies and industry, and the profit motives, the way drug companies have handled these things, like the opioid crisis. They create legitimate skepticism. And I think that Kennedy, he speaks to people's desire for autonomy and control over their own health decisions. And I understand that.
So here in Canada, the biggest pushback to vaccines came in contexts where people were required to take vaccines. So we had this big, and maybe you heard about it, these truckers
Yep.
occupied central Ottawa.
Yep.
And the reason they were mad is because there were cross-border, well, one of the reasons they were mad, there were these policies that to be a cross-border trucker, you had to be vaccinated. So to cross the border into the United States, come back to Canada, you had to be vaccinated. So it was a requirement. It was a mandate. And that pushed them over the line. Some of them were anti-vaxxer COVID conspiracy theorists, but not all of them were. Some were just civil libertarians who were like, my body, my choice. My theory, and I'm wondering what you think about this, is that from the get-go, the policy on vaccines should have been, we're going to charge you $20 for the vaccine. But today, just for you, we'll give it to you for $5. Oh, it's Thursday, we'll give it to you for free. Make people feel the reality that they're getting something of value. That if you charge them even a nominal amount for it, even if it's $1, you're sending them the signal that this is an incredibly valuable thing, which it is. It's like, it's one of the speed with which COVID vaccines were developed was one of the greatest medical breakthroughs of humanity. But as soon as you say there's this thing that you have to get for your kid to go to school or to cross the border or to get this job or to work for the government, then it's like, oh, it's like wearing a seatbelt. It's like, oh, I got to change out my light bulbs for CFL bulbs. Like people immediately categorize it and slot it into a kind of like government rule rather than what it is, which is a miracle drug. It is a miracle of human engineering. And I feel like even making people pay a nominal amount for it, just the symbolism of it would have awakened them to that fact. But I have no proof of that. Like when I took a trip to Florida, I went to the shop, I went to Aventura Mall in Miami, and there were the people, they were begging people to get vaccinated. They had set up a stall, this is I think 2022 or late 2021. It was like, please come get vaccinated. And I saw the way people respond. It's like, stop bugging me. Like they're not bugging you. They're offering you this incredible medical miracle. And you're saying no, because it's going to take 4 minutes of your time that you'd rather spend at Abercrombie and Fitch. Like I'm trying to think of some way to awaken people to the value they're getting rather than see it as some kind of obligation.
Yeah, no, I get it. I mean, mandates are a really complex issue. Because,
Like did Stanford have a mandate for students and faculty?
Yep.
Okay.
Yep.
And what do you think of that? And how do people respond to that?
Well, man, I mean, I have various thoughts. But first, I will say that the data are clear that mandates work. They're highly effective at increasing vaccination rates
In the short term.
in the short term. Do they backfire on public perception? Yeah, definitely. I think that they've caused a lot of issues when it comes to vaccine confidence, for sure, around COVID vaccines in particular. But thinking about other vaccines, when it comes to like school entry requirements, even when they allow non-medical exemptions, the requirements significantly boost coverage, and making exemptions harder to obtain is also effective. But there's an interesting historical lesson. So in the 1800s, compulsory vaccination laws, where people could literally be vaccinated against their will, often did backfire. So they actually increased vaccine opposition, and they led to the ultimately to the repeal of these laws in multiple states. And so heavy-handed approaches can definitely cause more resistance than compliance. And I think the key is distinguishing between mandatory vaccination, where there's a societal or financial consequence for not vaccinating, versus compulsory vaccination, where it's forced. And most modern mandates are really requirements with exemption processes. So yeah, I was on the Stanford Vaccine Advisory Committee, and we, discussed a lot of exemption cases, and and it was challenging at the time because the data were less clear than they are now, that COVID vaccination, in terms of the effect on transmission, and and we're trying to protect our patients and our staff and the vulnerable. So I think that from a public health perspective, mandates make sense when you're dealing with highly contagious diseases with serious consequences, especially in settings like schools, where transmission risk is high. But they have to be implemented very thoughtfully. We definitely need to learn more about this, and learn from mistakes made, and think about creative ways to compel people to get vaccinated, whether it's, eh, selling them or whatever. But I don't like the idea of like making people pay for vaccines. I think people should
No,
have.
no, you say this is $5, but today's Thursday, so I'm giving you two for free because
Okay.
people love a bargain.
Yeah.
So you would
Okay.
never actually collect the money. You would just always
Yeah.
you know what, this is probably short-sighted because they catch on pretty quick. By the way, I should say that some of my biggest anti-vaxxer friends in the United States, it's interesting because money talks. And there's one guy I know, he's like a huge anti-vaxxer. And I said, so you didn't get vaccinated? He said, well, no, actually, I work for a defense contractor. And if you work for a defense contractor, you're subject to the rules of the Pentagon and the federal government. So I had to get vaccinated. And once he decided, well, I'm going to do it to keep my job, that was it. He just did it. Like, it was kind of interesting that some of these guys, despite all the rhetoric, once they actually decide to do it, they kind of shrug and they just do it. Although I do think some bitterness lingers on. It becomes just part of their set of umbrages about the big state.
For
Um,
sure. For sure.
yeah,
And I get it. I totally get it. I mean, the goal should clearly be building confidence through transparent communication, and addressing specific concerns as honestly as possible and thoughtfully as possible.
in your first article, you talked about like the first smallpox vaccines. Some of the first pioneers of vaccines, the way they built trust is they gave it to their own kids,
Yeah.
which is totally unethical by modern standards. But you can see how that registers with people. It's like, it's like the guy at the World's Fair who built the first Ferris wheel, and he said, to prove it's safe, I'm going to go on it with my family. Like it's that kind of thing. I guess it'd be kind of weird for doctors to be seen on television injecting themselves. Although you do see politicians rolling up their sleeves and going, like, was that of any value when you'd see politicians rolling up their sleeves and getting vaccinated?
Oh, I mean, I don't know. I mean, in the end, maybe that backfired. Some people who had selfies on Twitter of getting vaccinated, I think, were criticized. So
I didn't even like that. I didn't even like that because it looked preachy. It looked
yeah, totally. I agree. Yeah. I mean, but there's no one size fits all answer, and you can't please everyone. So I think that in some cases, mandates as a backstop for protecting like community health. There are times when that might be necessary, but it's very risky when it comes to maintaining vaccine confidence. Like forcing anything, especially when it's the government forcing something. That's pretty.
especially Americans. Canadians don't mind it so much.
It should be the last resort. But we should study this. I mean, that's the thing. Like with these advisory committee work groups, instead of looking at things that have been clearly debunked, like they're looking into whether or not, mRNA technology is a gene therapy. Well, I mean, that's like that's
It's
like
not. Yeah.
we have
Yeah.
definitive answers to that. Why don't we look into, you know, vaccine mandates and what could have been done differently, maybe, things like that.
The realm of the psychological, not just the virological. It is, among other things, a marketing challenge. Dr. Jake Scott, thank you so much for joining the Quillette podcast.
My pleasure. Thank you for having me.